Hey everyone, welcome back to XGate Dental. I'm Emmanuel Kadosh, and we are here to discuss new procedures in the field of dentistry. We'll provide interesting new cases to exhibit how doctors use our products to solve complicated dental cases. So let's get started. Today we brought in a case that is not connected to implants at all, and we just wanted to show you the different kinds of techniques for frontal teeth, more specifically for the aesthetical parts. And here we can see the patient fell and broke a couple teeth. These teeth probably need a root canal treatment and a crown. This one you can restore with a composite material. Now in this case, what we want to do is to show how we're doing it in the clinic in the easiest way possible and get the best results. The main problem in this case is with the aesthetical aspect. We need to make only one crown. So the difficult part is trying to make the crown look similar to the other teeth. And it's very hard to color the crown in order for it to look exactly the same. Now, if you're making 6 crowns, it's easy because the technician or the doctor can make the glaze. And when you're doing more than one crown, all of them will be the same color. But if you want to make one tooth look the same as the other teeth, it's quite hard. So the first thing that we did is we prepared both of the teeth. You can see here both of the nerves of both of the teeth. You have a broken part of the tooth that you can just take out. Later on, when we started analyzing the case, we saw that this tooth also needed a root canal treatment because the break was quite deep. We prepared and scanned the teeth, and while the technician made provisional crowns, we did the root canal treatment. So after 2 to 3 hours, the technician gave us 3 crowns and 1 small bridge, and the patient was done with all of the root canal treatments. So now you want to wait for the gingiva to heal. We want to wait for it to have some continuity. In this case, you need to see how these teeth react. Maybe you'll have some kind of problem with one of the teeth. So in most cases, you want to make a provisional crown. Give it some time to heal, and after we made the provisional crowns, we took the impressions again and made the post and core for each tooth separately. We cemented the post and cores, as you can see. They're all made from zirconia because you need to have an aesthetical post and core. You don't want to have them be metal because the crowns for the anterior teeth aren't translucent, and you want all of the material to be white and to be the same color. So in this case, we use the zirconia cores, and you can also make them from composite material or fiberglass post. Then we took impressions on the post and cores, and we prepared the zirconia bridge. Now here you can see the crowns after the glaze and after the whole process. The main problem that we are cementing the crowns is the residue of the cement. It will get stuck between the teeth or between the crowns and the gingiva. So before you cemented the crowns, you have to clean the residue of the cement. So before cementing, we take a little floss and we turn around the crowns where the residue of the cement is going to be. This way we can use the floss to clean between the crowns and then take it out slowly. You can also see that the color of the crown is very similar to its own teeth. What we did is all the glaze parts we made in our clinic. The patient came to us and we just colored the crown with the glaze in the clinic. You wouldn't need to send it to the technician. The whole process is much easier when you do the glaze and color yourself. All you need is an oven and then, of course, the glaze. All you have to do is just color the crown, and that's all. It's super simple, and it's actually quite affordable too. Every technician has it, which means that every doctor can also have it. There are also courses, of course, that you can take in order to learn, and YouTube videos. The most important part is the residue of the cement that goes between the crown and the gingiva. This residue is the case of inflammation, and then there's lots of different problems. So it's important to make sure that it's clean. Thank you everyone that joined in to learn some new and interesting information. Make sure to stay tuned for more, and of course, don't forget to subscribe, like, and follow. Thank you, and see you next time.